Hello, my name is Noelle. Welcome to my YouTube channel. Here I'm going to be talking about starting a series, hopefully, about therapy. And I wanted to make the series about DBT, which is called Dialectical Behavioral Therapy. And I figured to get started with this series, I wanted to get some things. First and foremost, I'm not a professional. I'm a patient. I'm a patient who's passionate about the form of therapy that has gotten me here today and kept me alive here today and helped me grow into a functioning adult somewhat. We do our best around here. And DBT has been my anchor in my healing journey. And what I can hope for in making this video is to give someone else something to hold on to for a little bit longer. And for some, you might not have access to therapy. You might not have the money or the insurance, or your parents may not even believe in it. And there's a lot of barriers, time, scheduling with therapy that I hope to bridge a gap here. I'm not a professional. I'm not a therapist. Yes, I've gone to therapy enough to where my insurance has probably bought what would have cost multiple diplomas of therapy practice. However, I am here and I'm alive today, and that's all we can do about it is share the good news. And I left that with knowledge, not a degree, not any money, and a lot of time well spent, I will say. I'm not done with therapy. I'm still a patient in therapy. I'm always learning new things. I'm always growing and healing, and that's not overnight. Once you learn all of these skills in DBT and other things of CBT, like, it's not a cure. It's to help you help yourself. You get out what you put into therapy and treatment. I'm not a doctor. I'm not a professional. I'm a passionate patient who has healed. And I didn't think I'd make it to 18. I didn't think I'd graduate high school. I didn't think I'd get a degree in college. Sure, it's only 2 years, but I didn't think I'd freaking finish that. I didn't think I'd do any of the things. I didn't think I'd turn 23 last year, and I did. And I'm 23 here today, and I've been in therapy since I was at least 13 years old. And I want to share more about that. And anyways, let's jump into it. What is DBT, and how is that different from CBT? From a patient. So to start off, we're gonna go with what came first. It's not the chicken or the egg. It's cognitive behavioral therapy was first created. It's the older cousin of DBT. And cognitive behavioral therapy is focused on changing distorted thinking to allow change in feelings and behaviors as a result. So your thoughts are believed to influence your feelings and behaviors, so much so that if you change them, then it would change how you feel. And yeah, that works if your main struggle is anxiety or depressive thinking, or you can slow down your thinking to reflect whenever you're upset. Now, why would this not help you? You know, like, I did CBT for a few years before I got into residential treatment and was introduced to DBT. And I realized why I ended up in a mental hospital and didn't just grow and get better before I ended up there. CBT doesn't work for people as well as DBT if they have challenging thoughts, if they feel invalidated whenever they challenge their thoughts, or whenever logic doesn't really have a say, whenever you're in a 100, whenever you go from 0 to 100 in the blink of an eye, having your access to your logical mind, your rational mind, goes out the freaking window. Or wise mind there can go out the window. And that's another skill DBT we can learn more about in another video I hope I get to make. I hope that this is received. But sometimes you're too intense to be logical. And whenever you're in such pain emotionally or just distress. And sometimes whenever I was doing CBT, I felt blamed for not being able to control my thinking. And, you know, you have intrusive thoughts, you have flashbacks, you have triggers. Sometimes your thoughts aren't necessarily your choice. And I'm still dealing with that. I'm still growing and learning every day. But I definitely learned that CBT was more based on thinking correctly. And I couldn't do that. And I felt like I was failing at therapy. And it was stupid because I wanted to go to therapy. No one was forcing me there. I was privileged enough to go to therapy. Nobody was forcing me there. And honestly, CBT leads to a lot of people that have BPD or just emotion dysregulation or a lot of other things where it's not just anxiety and depression, and it doesn't allow them to continue treatment because they feel so invalidated by this change your thoughts and then you'll be better kind of thinking. Don't get me wrong, CBT is a blessing for many. It was a curse for me. I do realize and recognize there are some parts of it that are beneficial to me. And I also realize that DBT is like, oh, that's like my second Bible. That's so much better than thinking I'm bad at therapy, because you're not bad if you're doing your best. And whenever we think about DBT, we always make the assumption that people are doing their best. People don't want to be stuck in a cycle of misery. People don't want to be miserable all their life. They just don't know how to change it. And that's why you need to learn about DBT so you can change it. And this is not just for the mentally ill. This is for anyone that has any struggles with managing emotions, needing to practice acceptance, or learn skills to manage intense emotions. Who was taught in this room, it's just me, who was taught how to manage intense emotions and feelings at a young age, or at all? Did school teach you that? Did they also teach you how to do your taxes? Because I didn't go to the right school, apparently. They didn't teach me crap. They didn't even teach me how to park. Anyways, DBT is focused on acceptance and change, whereas CBT is focused on change. That is why DBT is so much more helpful, in my opinion, because you're learning to accept emotions without acting in harmful ways. We're doing harm reduction. A lot of people with distress, with BPD, with complex PTSD, with triggers, self-destructive behavior can become second nature, become so hardwired from our mental illness or from our experiences that you may act out in harmful ways whenever you go from a 0 to 100 in the blink of an eye. I have no one to help or no skills that you know about to access or use in those moments. And so emotions they're very fast and intense for some. I am someone who is more emotionally sensitive, and that is part of the biosocial theory of DBT. It's a no blame shifting way of understanding emotional sensitivity. Some of us are more predisposed to be more sensitive to our emotions and our surroundings. And intense emotions can make people uncomfortable. I've been in that situation where I've realized that the reason why these people reacted to me being sad was because my sadness was too intense for them. They felt uncomfortable, so they just wanted me to stop crying. They didn't really want to know why I was crying. And that created more emotions for me and more, it's the theory. I can make a whole video about that. And I will. I hope you guys will tune in for that as well. And I wanted to say that DBT, it works best if your emotions feel overwhelming, if you act impulsively whenever you're distressed, if your relationships get intense or chaotic, or if you've tried CBT and felt invalidated or stuck. Bing, 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 I win. I felt all of those. And now I'm gonna explain to you guys what DBT even means. A dialectic, what is that? If you don't know what a dialectic is, then dialectical behavioral therapy sounds like a bunch of mumbo jumbo. It's not. A dialectic is whenever two things that seem opposite can both be true at the same time without canceling either one out. Example A, I want to feel better. I want to be better. And I don't want to take my meds. They taste bad, they smell bad, they cost too much money, they cost too many appointments to be able to be prescribed the meds, and I have side effects for my meds. And I still need those meds. And notice I'm using the word and. Another one would be, I accept myself as I am, and I still want to change and grow. So you accept how you are, and you acknowledge that there's room for improvement. That is a dialectic. The key way of distinguishing what's a dialectic and what's not is the verbiage. The words both and I can and I will are good at creating a dialectic and having dialectical thinking. The words that we're going to ban in DBT and hopefully in all areas of your life are should or but. Never catch yourself shoulding on yourself, okay? We don't do that around here. We don't but either. The reason why is because but cancels out whatever was said before. So if I were to say I want to feel better, but I hate taking these meds, that doesn't really sound like I want to get better. It sounds like I hate these meds. Whenever in reality, I think both and to be true. I want to get better and I don't like taking these freaking meds. Should is a judgment word. We ban judgment words because they fight against reality and they lead to feelings of shame and guilt or just straight up anger and frustration. Both and I can and I should, or we're not shoulding, I can and I will, they allow for complex, nuanced, and simultaneous truths. Dialectical thinking. I can and I will is better at fostering action, not shame and guilt. Because you don't want to say, I should have done this. You say, I can and I will. In the future, I will do this. We're not going to focus on the past of what you did wrong in your mind, because that creates guilt and shame that can make you feel so much worse than if you just focus on what you're going to do different next time. Okay, other examples of dialectics. I'm struggling and capable. My pain is valid and my actions matter. This situation is hard and I can cope. Another dialectic I like to think about is I didn't create all of these problems that I'm facing, and I am responsible for taking care of myself and having myself safe as I navigate these problems and grow to be stronger. It is your responsibility to get the help that you need. It is not your responsibility to assume all blame for everything bad that's ever happened to you, because no one needs to live like that. And sometimes we subconsciously let ourselves live like that. So dialectical thinking and both and I can and I will, they allow you to believe that you're doing your best you can right now, and also allows you to believe that you can learn to do better. We're doing the best with what we have right now, and there's more for us to pick up along the way, more tools we can put in our tool belt of therapy and of managing intense emotions all the time. And the more tools we get, and the better we get at using the tools, the more practice we have at them, the better life is going, your quality of life will be. And that is a focus of DBT, is improving, creating a life worth living. You don't want to recover from an addiction to slide into another addiction. You want to recover from an addiction to realize that that was you in survival mode, that was you at your worst. And your worst day in recovery will always be better than your best day in, addiction or whatever habits or slip-ups you've been dealing with. Those kinds of behaviors. It's always going to be better to be doing your best to heal than be throwing all of that away to slip and slide into past habits that have hurt you now. Another thing is to acknowledge that you didn't just start deciding, hey, I'm going to make my life harder. I'm going to do all these things. I'm going to have to go to therapy to learn how not to do, or I'm going to have to go and look up on YouTube ways to not do this. Like, all of these negative coping skills, they were coping skills at one point. They did serve a purpose. And now the purpose has become more harmful than helpful. That's whenever you say, I need to change my formula and find new coping skills that are healthy. We're not replacing one bad thing with another thing that's less bad. We're replacing it with something that's better, that is sustainable, that you can maintain and that you can grow on, and a foundation that you can keep building and building and building into a fortress. And you'll be able to escape prison in your mind. Okay. So dialectical thinking softens extremes. Extremes are all or nothing, or black and white thinking. These cognitive distortions, you want to soften those. You want to be less distorted in your thinking. You want to be able to see the truth and look past those normal ways that your brain goes, black and white thinking. You want to be able to stop, think, wise mind, check the facts. These are all skills in DBT that allow you to create flexibility and make room for choice of response versus a push to reaction. A lot of us react, and we don't have enough time or skill to think of how we could respond instead. It's less about being right whenever it comes to DBT and dialectical thinking. It's more about reducing your suffering and reducing it more and more and more each time to where your suffering is minuscule. It is manageable. It is not crippling. That's the goal here. DBT is helpful when your emotions feel too intense to think your way out of. I'll get into this more. It was created by Dr. Marsha Linehan, who is a queen who has saved my life and many others. She created this treatment for those with BPD. However, she believes you don't need a diagnosis of BPD to benefit from DBT. She thinks everyone has a sprinkle of BPD traits, and I wholeheartedly second that. No one is perfect at regulating their intense emotions, at communicating with others interpersonally. No one's perfect at that. Like, show me, okay? Show me. Even my therapist and I will sit there and we'll be like, show us. Like, who? And then my therapist will say, show us, because every therapist needs a therapist. And I think that goes to show that if you think therapy is only for whenever you're super sad, depressed, everyone can benefit from therapy. That's all I'm saying. Marsha, through her own journey of struggling and being a doctor in this field, she believed patients weren't failing therapy whenever she would use CBT on them, and they wouldn't be able to control their thoughts and stuff. Therapy was failing them. If you have intrusive thoughts, being told to have correct thinking can be like a slap in the face. That is therapy failing you. She knew patients needed to be kept alive long enough to heal. That's where we sit with the reduced suffering. That's where we sit with the making it manageable and making it less of a hoop to jump over or jump through each time, because you're practicing more and more and more. You get better at it. So being kept alive long enough to heal, that's important when it comes to patients, because you need to be validated before you're corrected. Like, be valid in the fact that, yeah, that eating disorder you had, it was there for you whenever no one else was. It made you feel like you had something to fall back. It helped you numb out, helped you escape. It did that. And now it's killing you. And it's killing you faster and faster. And now it's in control of you. And now we need to correct that in therapy. So you need to be validated for correction, before correction. It helps you kind of understand it too. Like, this, I'm not crazy. I didn't just do that because I wanted to make my life harder. I did that because I didn't know what else to do. It was the only thing that worked. And so my brain just always went back to that because it's only thing that it knows. And she also knew that patients needed skills, not insight. Not just insight. We do need our insight, trust me, but we also need skills that we're able to reach towards. And we love acronyms. Marsha loves acronyms. So there's a lot of skills, like STOP, where you stop. You take the time to think, you observe, and then you proceed mindfully. Stop. But that's not natural for you just to know. And whenever it's an acronym like that, you can just, what am I thinking? I'm intense, distressed. Let me stop. And those kinds of skills are more than just insight. Those are things to do in those moments of distress and other moments as well. She wanted to create DBT as a way to survive emotions before analyzing them, or so that patients could survive emotions before they analyze them. That is where distress tolerance comes in. Like, stop would be one of the distress tolerance, where you do that whenever you're at a 100 and you didn't even know you were at a 50 last minute you checked, you were at like a 10. And you went 0 to 100 real fast. So she wanted to find a way for you to be able to have things like tip, where you add something cold, you dunk your face in water. I can explain so much more about this skill in another video. But things like that to help you get through the distressful environment and tolerate it. We're not accepting it, we're tolerating it for this moment, and then we're going to analyze them later. And DBT is focused on acceptance and learning what changes can be made for improvements and healing. This is where we're learning to build a life worth living. That is so important in recovery, so important in any form of depression. And I don't feel like you fall into addiction unless you've had depression, and then you're just breaking a cycle, but you can't supplement it with something more painful or less harmful. It's still harmful. You want to create a life actually worth living fully, not in another struggle. Research since has shown that DBT is not only helpful for those with BPD, but it's also helped navigate healing journeys from depression, anxiety, PTSD, including complex PTSD, eating disorders, substance use, and a lot of adolescents that have a hard time regulating their emotions or identifying, labeling. You know, it's helped a lot of people. And it also, DBT, Marsha Linehan, she changed how pain is understood by therapy single-handedly. With DBT, we're accepting that we're in pain, we're accepting that we have negative coping skills, and we're gonna change them. We're not just gonna say, hey, don't think like that. Just eat, just smile, just sleep, just relax. Those are all not effective, not efficient ways of thinking, and DBT goes against all of that. And again, therapy was failing the patients. That is where DBT comes in and helps you. And it changed how pain is understood. And DBT assumption that you need to make is that problem behaviors are attempts to cope, not character flaws. This is what I was getting at with, I didn't just wake up one day and start engaging in binging and purging. Never once did I say, let me make my life this much harder by starting a crippling addiction. Like it's not what most people want to do. And it just works one time, and then your brain's like, oh, let's just do that again. That worked. And eventually it takes over. It's your attempt to cope. It does not serve you anymore. And now we're going to learn healthy ways to cope. And that's not a character flaw. That was a survival mechanism that you used, a coping mechanism that you used to get through that time, because you didn't know the other things that are healthy. And now you're going to learn all those things that are healthy, and you're going to learn why you did those things and how to do things differently and break the cycle that you may have gotten stuck in. I'm speaking from someone who has had an eating disorder since I was 10 years old. So that's kind of my perspective on that. I didn't just choose to have food problems. You know, that's not it. And I wanted to talk about the pillars of DBT to close out this video that is way too long. There are different topics of DBT. First one is mindfulness, arguably the hardest pillar of DBT. It is about, without judgment, learning to notice what's happening in the present moment with your thoughts, your emotions, and bodily sensations. And there's distress tolerance, which is our second pillar of DBT, which is about enduring emotional crisis without making shit worse. Surviving intense emotions safely. You're not focused on solving the problem right away. You're focused on surviving and not going and doing a 180 to your negative coping skills or your self-destructive behaviors. We're gonna get through this shit without making more shit and making this shit worse. Don't make shit worse. Distress tolerance. Emotion regulation is to help you drive your bus instead of giving your wheel, because you're driving your bus. Anxiety might start screaming. Anxiety and depression might start screaming. For me, BPD might start screaming. I'm not giving the wheel over to my anxiety, depression, fear, BPD, insomnia. I'm not giving the wheel to them. Even though my emotions may be so overwhelming and my feelings may want to take the wheel, this is about us driving our bus. They can be, backseat drivers. I can tell them to shut up. I'm driving my bus. That is emotion regulation. You're learning skills to understand and name your emotion. You're learning skills to decrease the frequency of unwanted emotion, decrease emotional vulnerability. That's the biosocial theory that I was getting at earlier. Increase your wise mind, another skill that I was getting at. And to decrease emotional suffering. That is the epitome of emotion regulation. And then there's interpersonal effectiveness, which is skillfully communicating clearly, concisely, setting boundaries. This can be saying no or saying yes, or simply asking others to do things or to not do things, and maintaining relationships and ending ones that need to be ended, and respecting yourself and others along the way. We don't want to compromise our own moral compass in a interpersonal relationship. That's what interpersonal effectiveness is all about, is being able to be you with someone else and be happy about who you're being, and be happy about not feeling guilty about saying no, not feeling pushed into doing things that you don't really want to do. And there's a give and take in all of those relationships where you may do things you don't necessarily want to do that don't harm you, because you know that next time, whenever you need them to help you out with something, they'll help you. There's that give and take, the push and pull of a relationship. that is important in interpersonal effectiveness, to manage your boundaries and your safety and respect at the same time as you're doing those relationships. Those are the pillars of DBT. Again, mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. I intend on making videos about all of these, and there are many skills, many acronyms. Miss Marcia loved to use acronyms. Some of them make no sense, but they're easier for me to remember, so I guess that's why they make sense. And I want to talk about those with you guys, and I really hope that this video was informative in some way. Maybe I just look crazy. I'm gonna sit on this. I might disappear on my phone in my library, or I might post it. Either way, if you're seeing this, that means I hope to make more videos. I hope that this was something for you to hold on to for a little bit longer so that you can feel hope and your healing journey and your loved one's healing journey and society as a whole. There is hope, and there's also things in our control, and there are things out of our control. Worrying only makes you suffer twice. So do what's in your control, keep doing your best, and let things happen. And whenever you need to act accordingly. Stop, use your skills. And I want to get more into that with you guys. So I hope that you enjoyed watching this. I hope it didn't just sound like mumbo jumbo. So I wanted to get to the nitty gritty a little bit, but I also just wanted to make it less mumbo jumbo. So I hope that this was helpful. And I really hope you guys will come back and tune in to your next therapy video by Noelle. Not a therapist, just a very insightful patient of therapy for many, many years. So I hope you guys enjoyed. Again, be safe, be careful, use your DBT skills. I'll teach you some more and how they've helped me in the next one. I'll see you.